Welcome. This is the Dentist News Network. A new study has looked at laypeople's preferences regarding dental aesthetics. My guest today is Dr. Carlos Flores. He is Associate Professor and Head of the Division of Orthodontics at the University of Alberta, where this study originated. Dr. Flores, welcome. Thanks for taking the time to speak with us today.
Oh, thanks. Welcome. Thanks for the interest in the article.
So let's talk about what the goal of this study, what were you trying to achieve here?
This is a systematic review. So basically, it's a collection of manuscript articles already published. So in that sense, we didn't come with our personal data, but actually we collect data from already published, and then we'll try to put it all together to try to summarize all the information into trying to get some conclusions.
Okay, and it looks like from the findings that you found that there's a little bit of disparity between what patients want and what clinicians expect they want.
Yes. Now, having said that, dichotomy, that difference is not always, first, it doesn't always exist, and it's going to be different based on the aesthetic variable you are measuring. But yes, clearly dentists, for both parties, for dentists, they need to be aware that patients may not qualify or quantify dental aesthetics the same way as they do. And for patients also, they need to be aware that the dentist is going to be offering them options, and then that they need to also raise their voice and tell the dentist what they do think. And then they have to basically come at the end of the day with an agreement about what's the best scenario, aesthetically and functionally.
So it's important to establish good communication in the beginning, but a lot of times with a patient and a clinician, the language is completely different, and so therein lies a small problem.
Yes, and then that's where dentists nowadays, we tend to use more of visual aids now to explain our treatment objectives. And so that basically will allow patients to hopefully better understand, because yes, we do use sometimes two technical words, and that they're clear in our minds, but then patients may not even ask what they mean.
Well, we as patients often don't really want to know. Let's talk about some of the specific findings here with regarding dentitions, for example. I mean, we're talking here really about numbers in a lot of ways.
Yes, and the big thing, this scientific article is published in a dental journal, so it is not written for the consumption of the lay people. So in that sense, this is basically, the message basically was driven to the dentist for them to realize that there could be differences in perception about the aesthetic factors. Ideally, this message should be translated or modified to make it shorter and more to the point for the patients. But I think that part of it is probably the dentist's job. That's right, to provide dentists with a summary of this. And this is a moving target, right? So once you publish a systematic review, and we did basically search for evidence until middle of last year. It could be that some papers will appear between summer of 2010 and even today that could basically change slightly the conclusions. I've been following up the articles. I don't think there's anything that will change them. But let's say in 5 years, these conclusions that we came together may be different based on new research that's published. And so that's a problem with systematic reviews when they're published in a journal, is that they are not a live document. They're a snapshot on a given time.
Within the specifics of the findings here, and again we're talking about the aesthetics of dentitions, uniformity in some areas, and we're talking about small measurements. What is your message to clinicians? How can they best use this information?
Well, when they are treatment planning, the first thing is obviously when the patient comes to practice, you need to hear really, really careful what the patient wants. And it's always good to paraphrase what the patient wants and then confirm that that's what they meant. Then the dentist needs to be aware that some of their critical goals regarding aesthetics may not be the same as patients. In general, I will say that dentists, we tend to be a lot more critical regarding small dental aesthetic details than the laypersons. And so laypersons are probably going to be more than happy with, let's call it, an 80% accomplishment of any given aesthetic goal, while the dentist is always pushing for that 100%.
Which is a good thing.
Yes, but then in some areas that attaining that 100% may require some extra work. It could be time. Usually more time is associated with cost. So then is that extra 5% worth it, the time and cost involved? If the patient is going to be... Now, obviously, the dentist's job is to kind of determine clearly what are the functional goals.
And I guess in some cases here, it sounds like more than words, visual aids probably could be particularly useful.
Yes. Yes.
Okay. Where do you go from here? What other things are you working on in this area?
So when we did work this project with Dr. Matthew With last year, we came with a significantly large document. So we had to basically, to be able to publish it, we have to split that initial document in two parts. And so the one we are discussing so far, it's the one published in the JAVA in the month of June. The second part of this original manuscript is going to be published in the August. So it's already in press. Now, this first part is about tooth factors. So basically measurements that did regarding the width, the height, how they're coming together. The second part in August is going to give the idea of what we call peridental factors. So how do the gums, the level of the gums, the color of the gums, how the lips and the smile around the teeth are also important. So I think my suggestion will be that you need to have both documents at the site to get a complete picture.
My guest is Dr. Carlos Flores. He is an associate professor and head of the Division of Orthodontics at the University of Alberta. Dr. Flores, I appreciate your time. Very interesting. Thanks for sharing it with us.
No, thanks a lot again for your interest and thanks for following up.
You're watching the Dentist News Network.